A lot of the movement is for action now and not later, that something has to be done right now. How do you feel about that?
You know, I think something has to be done, but I think that the state is actually taking the role of trying to do something. You know, when I was in the legislature, I was very proud to work with Governor Bredesen and the legislature to pass a very unique program called Cover Tennessee and Cover Kids and Access Tennessee and other types of health care programs that help fill in that gap for those people that might not qualify for TennCare but aren't able to purchase insurance in the private market because their employer perhaps is small enough that they don't offer health care coverage. Sure. So I think what we've got to do is keep working with our state insurance programs, continue to expand the options for people in Tennessee. We've done that successfully ever since we started Cover Tennessee. We started with employers who had 25 or fewer employees. We upped that to 50 or fewer employees. So I think we need to keep expanding those options for some of those state insurance programs to allow employers to have the opportunity to provide that health care insurance for their employees.
Are you concerned at this point about state-funded mandates coming down from the U.S. government?
Oh, absolutely. You know, as I said before, I've spent my entire public service career in state government, never chosen to try to seek office at the federal level. So I truly believe in state government, and I understand the impact that unfunded mandates put on the state of Tennessee. I served on the Finance, Ways and Means Committee when I was in the state legislature and on the Budget Subcommittee, so I have some direct experience with understanding how difficult it is when the federal government tells you to do something and then doesn't pay for it. So I am very concerned with that and think we need to continue to work with our colleagues in Washington to make sure that that doesn't happen.
What role do you see technology and the advancements in technology playing in healthcare?
Oh, I think it is the wave of the future. I think that technology is certainly where we are going, and I think we've got to take advantage of all the wonderful types of technology that we have in the healthcare industry. You know, Governor Bredesen has been extremely active in that role. He serves in the Democratic Governors Association and in the National Governors Association on a number of committees that deal with technology in the medical field. When we talk about electronic medical records, that's really where we're going now. And if anybody doesn't believe it, go ask their children about Facebook, because I can promise you that Facebook, MySpace, and Twitter, technology is the wave of the future. It's where we're going, and we need to keep working on making sure that we give our healthcare facilities the ability and help to continue to transform into electronic medical records.
What role do you see preventative care taking in our future health care?
Well, I have to tell you, and if you read any of the statistics, you look at any of the articles, you look at any of the national media, you will see that that is where we have got to go. It's the only way we can, number one, cut costs in the healthcare industry. We've got to look at preventive care. It's so much easier to pay on the front end than it is to pay on the back end. We have a real problem in Tennessee with obesity, both childhood obesity and adult obesity. That leads to significant healthcare problems like diabetes and other types of chronic diseases that occur because of obesity. So we've got to work on preventive measures on the front end. Absolutely. We see that all the time. We see that in the education area. We see that in healthcare. We need to spend the money in the beginning before we have to spend it at the end.
Absolutely. Well, another very important topic, of course, in this state is education. Pre-K and K through 12 education is a huge part of the state budget. What we're doing right now in public education, is it enough, or do you see areas that we need to improve?
You know, it's never enough, and I think that we should never be satisfied. As a state legislator, as a member of Governor Bredesen's cabinet, I was never satisfied. As governor, I am never going to be satisfied, because I think we always have to keep striving to get to the pinnacle, striving to do better, striving to make improvements. So while we are doing wonderful things in the education field, we always need to keep striving to do better. And I think things that we've done in the pre-K area, things that we've done with the Tennessee Diploma Project, raising our standards, things that we're doing in that area, we're making improvements. But I'm one of those people that is always excited about striving hard to get better.
Right, right. Of course, being here at Volunteer State Community College, we're very concerned about the future of higher education and funding higher education. How can we continue to deliver affordable and much needed higher education without raising the taxes through the roof?
It's a very difficult issue, and as I told you before, Nancy, I am currently on the faculty and in the administration at Austin Peay State University, right. So I think that I have a pretty good working knowledge of our higher education system. My father was a higher education professor his entire life until he retired. My mother was a teacher in the K through 12 system, so I was raised in an education family and in a family that realized how important education is to the future of our state and of this country, quite frankly. So we have really turned the corner and have realized that higher education is really the future to the high-paying, good jobs that we're seeing. So we've got to really work on that. And I think things like you're doing here at Volunteer State Community College are wonderful, because what we've realized is it's not sometimes all about a 4-year degree anymore. Sometimes it's about a 2-year degree. Sometimes it's about a 1-year technical college degree. And we've got to continue to focus at that level on articulation agreements so that people that come to Volunteer State, if they want to complete their 4-year degree, they're able to go to another school and have those credits transfer. So we need to work on that. We need to look at the governance structure of Tennessee higher education and make sure that we're doing things that focus on students and focus on teachers and focus on the education that students receive, and maybe not as much focus on the administrative duties. So those are areas where I think that we can continue to explore. We have explored in Tennessee, but we've got to make sure that we keep that tuition down. We've got to make sure it's affordable, and that's why we even formed the lottery scholarship program, to do just that. So we can make changes in the lottery scholarship program to continue to provide access to people in Tennessee to get that higher education degree.
How successful do you think the Hope Scholarship Program has been? And you just said we need to make some changes. What adjustments do you think need to be made in that program?
Well, I think we need to continue to look at things like the exact amount of the scholarship. As tuition continues to increase, the amount of the scholarship needs to increase. And so we need to look and make sure that we don't have unused funds that are sitting there that we could put towards additional scholarship programs. We need to look at continuing to make sure that we are providing access to those people like the non-traditional students who want to come back and go to school. Those students who want to complete their degree, who maybe just have a few more credits left, but for whatever reason have had to stop and they want to come back. We've got to make sure that the scholarship is available to those people also. And we can make tweaks and changes like that to really increase our total graduation rate across the state.
I know here at Volunteer State they've seen a huge influx of EMT students coming in, people who can't find jobs right now. How much does the unemployment rate bother you right now? I mean, it seems like everybody's just trying to get a job.
Oh, it bothers me tremendously, and I say because at the state level, I think what you see is when people don't have jobs, when your unemployment rate is high, number one, it has rippling effects across our entire economy and across our entire state government, because obviously when you have a tax system like we have in Tennessee that's based on the sales tax, if people aren't working, they don't have disposable income to buy things, which actually funds our state government, so that's a problem. They're not able to afford the health care that they need for their children. There's nothing worse than being a mother or a father and thinking, what am I going to do when my child gets sick? So we need to make sure that we have those health care opportunities. That's usually provided when you have a job. So we've just got to work on making sure that we get this unemployment rate down and bring in good jobs to Tennessee, retain the jobs we have, and continue to grow those jobs that we have.
You've been quoted in the Tennessean as saying that when Tennesseans are working, the nation moves forward.
That's right. It's so important that when Tennesseans are working, Tennesseans are able to be productive members of our state economy. They're able to provide for their children. They're able to provide for the tax structure. It is just the number one issue that I think the next governor is going to have to face, and that's making sure that we provide good jobs for the people in Tennessee.